I'm Dr. Kalaichelvi, consultant medical oncologist at Apollo Specialty Hospitals. I'm going to talk about lung cancer, the basic aspects of lung cancer, how you diagnose and how you treat lung cancer. Lung cancer is the most common cancer and the most common cause of death due to cancer across the world. Around 70,000 to 75 new cancer cases are diagnosed in India, that is lung cancer alone, and out of which 50,700 cases are in men and 16,700 cases are in women. Around 8 cases of new lung cancer are diagnosed every hour in India, and 7 patients die due to lung cancer in every hour in India. And this is the third most common cause of death due to cancer in India. What causes lung cancer? You must know the common causes which produces lung cancer among women and men. The most common cause is due to tobacco smoking. 80% of the lung cancers are due to smoking. And smoking in any form, that is, if you use cigar or pipe, or you use snuff, or you chew tobacco, or in pan parak, every form of tobacco is injurious to your lungs and it can produce lung cancer. The other reason is second-hand smoke. That is, those who smoke leave out the smoke fumes outside, and that causes cancer in people who do not smoke. And air pollution is the most important cause of lung cancer nowadays. The other reasons are the chemicals, exposure to chemicals like diesel fumes, radon, asbestos, cadmium, arsenic. All these things are there in the workplace or in the environment. These can also produce lung cancer in the long run. And also in some selected cases, there may be a family history of lung cancer. Why do non-smokers get lung cancer? Because they get exposed to the second-hand smoke by the smokers as well as the air pollution which contains diesel fumes. And these non-smokers usually are women and they are Asians. So these people develop adenocarcinoma because of the second-hand smoke, which is more common in our country, and that's the most common cause of lung cancer among women. So what are the symptoms you get due to lung cancer? When do you suspect lung cancer? Supposing the early stage cancers they do not produce any symptoms and they are incidentally detected by doing some X-ray for other reasons. But some of the lung cancers, when they progress or when they increase in size and press the airways, you may get persistent cough, which will not go away with regular treatment. A cough which persists for more than 3 weeks, you should become suspicious of any pathology inside the lungs. The other symptoms like coughing up sputum, sputum with blood, sometimes fresh blood in the sputum can also be due to lung cancer. Persistent cough or wheezing, sometimes shortness of breath or difficulty in breathing while climbing the stairs, and unexplained weight loss and unexplained tiredness, reduced appetite, all these can be part of a sign of lung cancer. So if you find any one or more of these symptoms, you should visit your doctor and get investigations done to find out the cause of these problems. Sometimes even change in the voice or hoarseness of voice can be an initial symptom of a lung cancer. Once you have detected that it is lung cancer, how do you go about, or how do you detect lung cancer? By doing some tests. The tests are usually X-ray chest or CT scan of the chest. If you find any tumor or mass inside the lung, then you may have to go for further testing in the form of a PET CT scan of the whole body and a biopsy. Sometimes you may need a bronchoscopy to identify the mass and take a biopsy from that. So you need to go to an interventional radiologist or a pulmonologist to get a biopsy. An interventional radiologist will look at the lung tumor mass and then they insert a needle through the CT guidance and then take a biopsy of it. Whoever is taking the biopsy will be able to take more material because you will need more lung tumor tissue for further testing. Not only for confirming the lung tumor, but you need to have material for doing special testing like immunohistochemistry and molecular testing. So once you confirm that you have a lung cancer, then the next level is what type of lung cancer you have. There are two types. One, the most common one is non-small cell lung cancer, and the other one is small cell lung cancer. 80% of the lung cancer cases are non-small cell lung cancers. And in the non-small cell cancers, you have certain subtypes. And there are two common subtypes, which are the squamous and the non-squamous or the adenocarcinoma. The other types are the adenosquamous and the large cell and neuroendocrine varieties. But the most common one is the adenocarcinoma. The next one is the squamous cell carcinoma. Then why it is important to identify whether it is squamous or non-squamous, that is adenocarcinoma. In cases of adenocarcinoma, in 50% of the cases, you may have some molecular alterations when you do a testing. Then these alterations will allow us to give a targeted therapy or the tyrosine kinase inhibitor therapy, which will make the disease get better, or you have a longer survival in these patients when you have a mutation. So it is important that you get a correct diagnosis of adenocarcinoma so that you can proceed further with molecular testing. What are the other tests available for to identify molecular alterations? One is the broad panel testing by the next generation sequencing, or otherwise called NGS. Then you have RT-PCR for selected molecular alterations. Then immunohistochemistry and FISH testing for some other molecular testing. So NGS is the most common one recommended for checking for molecular alterations. And what are the molecular alterations you can expect? Like you have the EGFR, ALK, ROS, MET, and KRAS, NTRK gene alterations can be made out by these NGS panel, and so accordingly you can treat a patient. So once you get the pathology testing done, then probably the next step will be you have to go for staging. What is staging? Staging means that you identify whether the disease is still in the early stage, or it is an advanced stage, or it has spread already from the primary site of origin. So the staging includes CT scan of the chest, CT of the abdomen, and MRI of the brain to identify the disease spread, or in one shot you can have a PET CT scan of the whole body to identify whether the disease has gone from the lungs to the opposite side of the lung, or the neck nodes or abdominal nodes, or the liver or the brain. So once you do all this testing and routine blood tests, then you have to stage the patients. That is, stage 1 and 2 is called early stage. That means the disease is limited or it is in the site of origin, and there is no nodal involvement. That is early stage. And stage 2 and 3 with nodal involvement is called locally advanced. And stage 4 is actually metastatic disease, that is the disease which is spread outside the lungs to brain, lung, or bones. So now once you get the stage, you have to go for treatment. What is the treatment available for lung cancer now? You have plenty of options now. The early stage cancers are best treated by surgery. You have the best chance of cure for early stage, that is stage 1 and 2 are surgery only. And after surgery, some patients will require adjuvant chemotherapy, and this chemotherapy makes their survival better. So what if it is locally advanced, that is stage 2B and 3, you need to give chemotherapy and radiation simultaneously, that is concurrent chemoradiation, and then later you decide whether you can go for surgery or not. And for metastatic disease, that is stage 4 disease, you have systemic therapy is the option for these people. And systemic therapy is given for those people who are in good performance status or in good general condition, like performance status 0 to 1. And this treatment requires chemotherapy in people who are in good general condition. The chemotherapy usually involves cisplatin or carboplatin in combination with pemetrexed, paclitaxel, gemcitabine, or etoposide, or vinorelbine. Usually a combination chemotherapy is given initially. 4 to 6 cycles will be given at an interval of 3 weeks. Then after chemotherapy, some people may require maintenance therapy with the same chemotherapy or different medicines. Now coming on to the targeted therapy or the tyrosine kinase inhibitor therapy for those who have a actionable mutation or molecular alterations which is done by your NGS. So when you have a EGFR mutation, you can always, especially exon 19 and 21, you are eligible for a TKI therapy. This TKI therapy includes afatinib, geftinib, erlotinib or osimertinib, and your doctor will decide which treatment to be given to you. When you have an ALK mutation, you may require crizotinib, alectinib, lorlatinib or ceritinib. So this also will be decided by the doctor. So there are other mutations where your doctor will decide what treatment is suitable for you. The KRAS mutations they have a poor prognosis and the patients don't do very well. And when you treat the patient with targeted therapy or the tyrosine kinase inhibitor therapy, the response will be good in the initial period, around 9 to 13 months, and later they develop resistance to the drug. So at that point, you need to reinvestigate, do a biopsy, find out if there is any other mutations or alterations in the lung tumor tissue. So if you're not able to take a biopsy, there's another option of taking a liquid biopsy, that is circulating tumor, cell-free tumor DNA, which can be tested for any alterations, but that is not a substitute for a biopsy. So what is the other therapy available is the immunotherapy. Immunotherapy is where, these medicines make your immune system work better or attack against the cancer cells and destroy them effectively. So some of the targets like PD-1 and PD-L1 which are present on the T cells of your immune system, and these drugs will go and combine, block them and make the immune system attack the cancer cells. So we have certain drugs like pembrolizumab and nivolumab and semiplenimab, which can be used against in the initial part of treatment. We also have atezolizumab and durvalumab, which are also used in the treatment of lung cancer. Some of these immunotherapy drugs can be used as first-line treatment along with chemotherapy in metastatic lung cancer patients who are fit and they also express PD-L1 in their tumor tissue. And then sometimes in patients who are not fit for chemotherapy or radiotherapy, you can give only immunotherapy in selected cases. And sometimes after chemoradiation, some patients may be benefited by immunotherapy as consolidation or maintenance. In selected cases, in early stages also, immunotherapy can be used along with the chemotherapy before surgery. So immunotherapy is an effective treatment where nowadays it is commonly used in patients who become eligible because they express PD-L1 in their tumor tissue, especially more than 50%. Though you can use this immunotherapy when the expression is more than 10% also. And this easier therapy which is given as intravenous infusion, but they are expensive. So it cannot be used in all patients. And also sometimes they may produce autoimmune reactions which may make it difficult for us to continue with immunotherapy. So once you continue a treatment, you need to follow up the doctor. Once the treatment is over, you would like to know how long the patient will survive. The stage 1 and 2 patients will survive up to 5 years. That is 45 to 82% of these patients can live up to 5 years. And stage 3 patients, up to 35% of them will survive for 5 years. And stage 4, that is metastatic disease, only 6 to 9% will survive up to 5 years. With the present era of targeted therapy and immunotherapy, the patients with metastatic disease, up to 35% of them can live for 5 years, and that is the effect of the recent advances in the treatment. How do you go on with their follow-up? So every patient who is on treatment or follow-up treatment, they should go to the doctor for every 3 months for physical examination and for some image testing. And once 2 years are over, then you need to go around every 6 months for CT scan of the chest or PET CT scan. So during follow-up, your doctor will identify if the disease is under control or is a recurrence, and if there is a recurrence, they will do accordingly a biopsy and retreatment. So the most important thing during follow-up is that identify the smokers and then make them, stop smoking or cessation of smoking, which is very important. If you continue to smoke during treatment, the treatment may not be very effective, or you may develop relapse much earlier. And a most important thing is you may develop a second cancer also. So the smoking cessation is very important, and doctors should help the patient to stop smoking at any point from the beginning till the end of the treatment. So to conclude, the lung cancer, which is the most common killer in India, and the treatment includes surgery, radiation and chemotherapy. Now you have targeted therapy and immunotherapy, which can be decided by your doctor. Thank you.